My name is Dr. Paul Locus, and I am a obstetrician, gynecologist. I deliver babies, women's surgeries, women in the office for medical problems. I just moved here from Texas, around Houston area, which is a very big place, which I was been there for about 7.5 years, and I was trying to move away from there. Before that, I was in Austin, Texas, which is also a big place, not nearly as big as Houston. And before that, I was in the Air Force and stationed in a few places, in Wichita Falls, in Austin, and a little way south of New Orleans. We've moved different places, also based on the places my wife wanted to go to. So we're a team. So we've been married for 34 years. So I'm no better than to disagree with her when she wants to go to places. I just try to find a way to get there, and it works out great. We've had great experiences in all the different places we go. We have 4 kids, and they've scattered now. They're older. We are the first 3. The oldest one's a teacher. The second one's a teacher. Our second daughter's deaf also. And she went to college, and also got a master's, and she teaches at a Kansas School for the Deaf. My oldest daughter teaches in Hartsville, a little ways east of Nashville. My youngest daughter is just in a doctoral program, so she wants to teach college math. She's a number theory person. And then my son, he was the 3rd in rank, he is in the Navy. He's a nuclear electronics specialist on an attack sub stationed out of Guam. So in moving to Tennessee or coming to Tennessee, we were looking to get to a place that's a little closer. One's in Kansas City, one's in Atlanta, one's in Hartsville, and this area of Tennessee seemed like a pretty nice place to be as far as geographic location and proximity to the kids. I don't give directives like we're doing this. It's more like I feel my job is I educate the patients. When the patient comes in, we're going to chat for a while. I need to know who they are, and at least on the initial visits. And after that, we'll get to know each other. Whenever there's a problem going on, the patient is the one that has it's their life, it's their body, it's all the issues that are having to do with them. So my job, I feel, part of it is to teach them what's going on, and that is in ways that they understand, and trying to get rid of all the big jargon, the medical jargon that we have, and put it in things that are understandable by the patient, depending on her, how much education she's had and where she is in life. And so once I get to the point where she understands enough medicine to know what's going on with her, then we can formulate a plan together. That is, we can make a plan that we both agree with. There are so many things offered here that are not offered in small towns. I've had privileges at some small town hospitals, even like 27 or 30 bed hospitals. And there's really just not. And when you're getting care in a place like that, it's great in the I have a relationship with my caregiver kind of a thing, kind of an aspect. On the other hand, the things that are offered are not always up to date, not always the latest thing or the latest proven thing that's best for the patient. At this hospital, though, in looking around, it looks like pretty much 90% of all the things I would find in the 4th largest city in the country, in Houston, is here in this hospital. So it's a great place to come in and get care, I think. And I feel like it's a privilege for me for them to have selected me and allowed me to come here to practice.